For over 20 years, the Fire Store has equipped first responders with the best in firefighting gear. Discover seasonal savings on the gear you trust and visit thefirestore.com to shop everything but the truck.
Hello, my friends, and welcome to Fire Engineering's podcast network. In this installment of the Professional Volunteer Fire Department, the podcast dedicated to our great volunteer fire service and the belief that developing and maintaining and enhancing a professional image and professional reputation, that's the duty of all firefighters, paid or volunteer. And true professionalism is never defined by a paycheck. Tom Merrill here. Thanks again for joining me. As we are soon to be entering the holiday season, time, as I always mention, just continues to fly by, and we're already approaching the end of 2025, and I just can't believe how fast this year went. And for me, it was a very busy year. Been traveling all over the United States. It's finally winding down. As a matter of fact, when this podcast airs, I think my travel for 2025 will be completed. But what a great year I had, meeting brothers and sisters all over the country, west to Utah and South Dakota, south to New Mexico and Florida, Missouri, eastern New York State, and way up north into the upper areas of New York State as well. Just all over, been great. And it just reinvigorates me, and it shows me there's still great people in this world. And as I always like to say, it reaffirms that the fire service is just loaded with incredible people. And our Maltese cross that we wear so proudly does demonstrate for all to see that there's still great people in the world. Soon to be 2026. I'm already filling up my calendar pretty quickly. If you'd like me to come out your way and talk about delivering the professional message, talk about building a professional culture, or any of the other programs that I offer, please just head over to my website, theprofessionalvolunteerfiredepartment.com or theprofessionalvfd.com. You'll have a complete listing of my programs. You'll also see where I'm going to be at any given time. So heck, maybe I'll be in your neck of the woods and we can meet up, and I would love that. And of course, highlighting 2026 will be the FDIC conference, the big show as I always call it, and I'll be back in Indianapolis in April. I think it's April 20th to the 25th next year. Looking forward to having just another great week in Indianapolis. And if you've never been, I encourage you to head over to FDIC.com and learn about it, register for it, start making plans now. And of course, if you have been, I don't need to convince you to go back for a second time. So just been a great year and a lot more coming up in 2026, and I'm looking forward to it. And speaking of my travels, last month I was in South Dakota, where again, I get off track here, but again, just met so many great people, so many wonderful brothers and sisters. And I was in Spearfish, South Dakota, which is absolutely beautiful, by the way. Just had a great visit there. The South Dakota Firefighters Association had a conference there, and I was introduced to someone who's doing some very interesting work that involves the volunteer fire service. And as I listened to what she was doing, I just knew we had to get her on this podcast to share her story, to share her research, and to share her goals with her research, because it involves the fire service. It impacts the fire service, especially the volunteer fire service. So I'm so happy to have Dr. Allison Barry on. She's an assistant professor in exercise science at South Dakota State University, and her work involves teaching exercise science undergraduate and graduate programs. And she's been focusing on cardiorespiratory fitness within the tactical populations, such as fire and law enforcement. And this information that she's gathering is used to create wellness fitness initiatives in the fire and law enforcement field, with the goals of better health outcomes, safety, and longevity for all of us, which I think, who wouldn't want that, right? And I know we all know it's a dark secret. We can all do better here. So she's currently involved in a research project, and it's entitled Empowering Volunteer Firefighters, a community-based approach to enhancing physical activity, or they call it PA in the biz, I believe, and nutrition. And we're going to learn about what she's finding out and what this empowering is all about and what community based approach is to this. So the project has the backing of FEMA and the Department of Homeland Security. And at the conference in South Dakota, she actually had some small focus groups. She was calling people out of classes to come in. I don't know if she was poking and prodding them or taking tests on them or what was going on. We're going to hear about that. But she had volunteer firefighters coming in and had discussions with them and found out a lot of things about them and their health and wellness and whether they had policies and what they did back home. And the overall goal is to learn just a little bit more about volunteer firefighters' physical activity levels and also create a strategic plan that will improve, hopefully, the physical activity levels and nutritional outcomes for volunteer firefighters. And it's important to note that the plan will be developed in South Dakota, which is nearly, I believe, it's pretty high. It's 96, 97% volunteer. But I'm sure she's going to share with us her findings, her ideas, her research applies pretty much to volunteer firefighters all over. And listen to this, folks. If she can get the word out, if we can help get the word out, if we can be honest with ourselves, we have the potential here to decrease incidences of sudden cardiac death and cancer diagnosis within our ranks. Who doesn't want that? But enough of me talking. Let's bring her on here and welcome to the show, Dr. Allison Barry. Thank you so much for joining me and taking the time to talk about this today.
Oh gosh, Tom, you should hype me up more often. I feel like really excited now, more passionate than ever after that opening. Thank you so much. I appreciate it.
It's so nice to have you here. And like I said, I was in South Dakota, and I always like to sit in the conferences and take the classes when I'm there. And I didn't have an opportunity for a couple of reasons there in South Dakota, but everyone was talking about it. And I know I call it sometimes the dark cloud in the volunteer fire service. We don't talk about our health that often, or things we all know we can do better. So I want to dive into that. But first of all, my first question is, how did you get involved in the fire service? Do you have any connections in the fire service, or did someday it just come to you that I've got to work on this?
So, the story's kind of funny actually, Tom. So I tell my students all the time and they get a kick out of it is I actually started working my master's and the first half of my PhD was looking at physical activity initiatives in preschool kids. So how do we get
There's
them?
a correlation there, I think.
Everyone says that. Everyone in the fire service says that.
That's the humor right there.
Yes, exactly. And so I, to be 100% honest with you, it was a good friend of mine, collaborator to this day. If you see any of my publications, Dr. Nathan Dix is on it, and he kind of had the suggestion for me. He is military himself. And I had an opportunity to work with a fire department where I was getting my PhD at the time. And, he's like, Allie, I feel like you could make a difference. I feel like this is something that needs to happen. No one else is really doing like objectively measured physical activity. They're really starting to talk about cardiorespiratory fitness. So we could be on the cusp of something brand new. I haven't looked back. I honestly, this has been, I talked with firefighters, all over the Midwest right now, and they're like, gosh, Allie, what did you do? Like, where did you volunteer? Were you a career firefighter? I haven't done it at all, to be honest with you. It's the people. Like, the firefighters themselves, I feel like I'm making a lasting impact because they want it. They want help. They want someone to care. And that, I feel like, is like the best thing that I can do. And especially for those who serve our communities. What better way to give back to individuals who literally can put everything on the line to help our communities? And what better fun group of people who not only are passionate about their health and wellness, but also give the ability that my students can come into the research and they can learn about tactical profession as well. So we're broadening not only the research in fire, but also the idea of what students can do to help tactical professionals. So I think we're winning on so many different levels. And now to get into the volunteer fire service, now that I moved up to South Dakota, a whole new avenue of adventure. I've worked with career a lot. Volunteer is something that's been new to me as of the last 2 years. But what I'm learning is everywhere it's the same thing, other than resource difference.
Interesting. We have a saying in the fire services, same circus, different clowns, wherever you go
Yep.
in the country. So,
Yes. Yeah. So I've just been really lucky, to be honest with you. I've been very lucky to work with wonderful departments, with wonderful individuals like you talked about at the South Dakota Firefighters Association. The South Dakota Firefighters Association champions this. And they are so excited and so passionate about it that it makes you want to do more. It makes me think about other avenues for funding and, what else can we do? But also, like you said in the opening, their transparency about it. What are the needs? And knowing that we have to work together along the way.
We've taken such strides in the fire service in general over the generations when it comes to safety and equipment. We're doing things so much differently today than maybe decades ago, and every decade is a little safer and a little better. But I do say, in my opinion, that the health and wellness of the brothers and sisters, I don't think has kept pace with some of the other initiatives that we've undertaken to make us safer, to make us better at what we do. And sometimes it's probably some of it's self-inflicted. We don't motivate ourselves. We know we need to do better, but part of it is also, I think, there's not enough focus on it. So it'd be interesting to hear how you dived into this and what your findings are. It's such an important topic. So how did this all start, and how did it take off to where you're at today?
So I have worked with career firefighters for, oh gosh, I started working with career in 2016, moved up to South Dakota in 2022. I was trying to figure out then let me start this over, I guess. So for research, what we have to do for our job, right, is we have to have this line of interest that's going to carry longevity for our career. That's also going to make an impact. I work at a land grant institution. We need to serve our fellow South Dakotans in a way that makes South Dakotans better. Like health, wellness, economic impact, like the broader scheme of how to make South Dakota better. Really, what better way than to serve volunteer firefighters, right? So taking what I learned in the career fire service, really diving in deep into volunteer and understanding that the resources are wildly different in the sense of like, who pays even for the equipment, who pays for maintenance, who pays for, any of the systems for the calls, anything like that. So this was like a really big undertaking for me to now switch gears for the idea of, I know what career does, but I really have no idea what volunteer does. So really reading about it, honestly, my philosophy is just reach out to people and ask questions. The worst they can say is no. But what I realized in South Dakota is everyone answered.
Wow.
How cool is that?
Yeah. Wow.
And so then a lot of it was just listening, understanding what the needs are, understanding where some barriers happen. I knew nutrition and physical activity and cardiorespiratory fitness, cancer, cardiovascular disease, sudden cardiac death. It was really big in volunteer and career, right?
Right.
So now how can I look at what are the resource availability or maybe even scarcity when we think about South Dakota, because our rurality of our state. As I was on a call earlier today, like, gosh, South Dakota is a lot of middle of nowhere. It's like, it is. So how do you get people resources to help them overall for health and wellness, right?
Right.
So a lot of it was picking brains of leading researchers in the field, Dr. Sarah Janke, Dr. Judith Graber, really understanding what they knew and getting their connections and understanding what they have already seen. But then adding my own spin to it, like what can I add that they don't do? Well, they don't really do physical activity. They don't do nutrition, right? That's not their area of expertise. They have people who they work with that do that. But now what can I do to really do that primary focus?
Yeah. Yeah. Interesting that you had, you had your objectives and you have your area where you're so knowledgeable, but you kind of had to sit down and listen to how the fire service worked, especially you had to educate yourself before you
Yes.
could start educating others.
Yes, yes. And so this is honestly, Tom, what was even more wild is that my current direct supervisor, who's also a mentor to me, Dr. Jessica Meendering, she was talking to me one day and she's like, Allie, you do community-based participatory research. I was like, I have no idea what you're talking about. Like, what is this? And it's really the structure of what I was just talking about. It's
Yeah, that's
really
a big term I saw in
yes,
my reading. There's an abbreviation. What's community?
yes,
CBR?
CBPR.
CBPR. Yeah, yeah. And I was going
Yes,
to dive into that. We might as well do. I was like, what is this? So I had to do some digging into that. And is that
yeah.
like a philosophy of how to do your research?
Yeah, so it's like a new methodology in a way where now we give equal shared governance of the research. So the idea that I sit down and I become educated about volunteer fire service in South Dakota, where it's different than if you go out to the Northeast. It's different than if I go out to the Pacific Northwest. It's different from the South, right? So like I really have to have then stakeholders who are willing to educate me, where I bring the evidence base, right? Like I bring the knowledge of what research is doing to the table, but one size does not fit all in the fire service, right? Like we know each department's different. We know each state's different. Each city's different. So how can we look at this at a broad swath, right? Like looking at this from that large 10,000 foot view, I need to look at South Dakota. So who's going to buy in? Who's going to help me learn? Who's going to help educate me? And this is where honestly CBPR comes in so swimmingly when we talk about what we do with research in the fire service, because I think the biggest mistake we make as researchers is that we go into, and this is why fire service, police, law enforcement as a whole, maybe even some regard and military is like, researchers go into fire and law enforcement because it's sexy, right?
Mm-hmm.
There's funding for it. But what happens when you leave? What happens when the research is over?
It just goes away.
It just goes away, right? So with CBPR now, I can look at ways to make this sustainable, to find ways that the firefighters themselves, when I have other firefighters on this, so I get feedback from them, the firefighters themselves, I know it could be sustainable. I know there might be longevity in this. I know that there might be buy-in in this.
Yeah.
Because I'm going to learn the terminology. I'm going to understand it. I'm going to understand how, in volunteer fire service, if it's on, like national land, sometimes you can get reimbursed for wildland fire, like all these things I had no idea about before.
Mm-hmm.
So then truly understanding, like, then the funding mechanism, some towns are just based off of fundraising only. Some have city taxes, some have county taxes. Like, it's wildly different.
Oh, yeah.
Where when working with career, you're like, well, it's the city pays for it. That's not at all the same. So a lot of that was learning the volunteer fire service holistically in South Dakota,
Mm-hmm.
to then say, okay, where can I meet them where they're at, but then enhance them at the same time?
Gotcha.
And so honestly, Charlie, who has been wonderful, you met Charlie at the South Dakota Firefighters Association, mm-hmm. Rick, I mean, like these guys, Tom, like wow. That's honestly all I can say is just wonderful humans, want the betterment of their peers, want to make a lasting impact in the fire service, and you can tell. And so their ability to push stuff out for me, more information, they are just so excited. They give input. I call them if I have questions or, anything like that. Like that's been so instrumental. And I think that's the one thing that you know, you can't replace. Like I could never learn that on my own. So there's this stakeholder method that I need. Jeremy Walla is like the fire chief representative for me on the project. And so he has the chief perspective and, the firefighter perspective, and the buy-in that they create is insane.
So you learned about the fire service, you
Yep.
talked to all these people, you
Yep.
good feel for us. So
Yep.
what then formed your objective? What type of research did you do? And then how were you narrowing it down to get to your overall objective?
Yeah. So that's a crazy good question. So using community-based participatory research, you start out with like the first year of my FEMA project, we did a needs assessment at the department level. So we sent out a survey that basically looked at like nutrition and physical activity policies, accessibility, barriers, what like their department demographics looks like, how many calls do they go on, the number of members, how many new members have they have over the last 5 years, right? Because we're also seeing that volunteerism is going down across the board, not just in fire service, but volunteerism as a whole. And so really getting that holistic approach. And in all honesty, Tom, we have 294 registered departments, 5 career of the 294. The rest are volunteer. Of that, I even had the fire marshal, South Dakota fire marshal, help out, and they sent out my survey to all the departments. I had a response rate about 65-ish departments completed it. Which when I was at the National Volunteer Fire Council fall board meeting, they were like, 65 is so much for one state, like that's so great, right? Like all these people from the different states. What I learned, nutrition and exercise, physical activity policies don't exist really.
Oh yeah, very, very. And I just wanted to ask real quick, when you sent out the needs assessment,
Yep.
Was it focusing on health and wellness needs or departmental needs as far as funding and equipment and things like that?
So it was like funding as a whole. Like, what is your annual budget? Do you have budget base for wellness initiatives? How many calls do you go on? Membership based by age and sex. So kind of getting like a holistic approach, but not also like really in-depth details, just to understand like, are you an active department? By how many calls are you getting? Classification, certifications. Do you have certifications? Do you require certifications? Right. And so it was like that real like baseline holistic view of the department in a way. And then went into like nutrition and physical activity policies. Do you have any? Are you aware of what like the National Volunteer Fire Council puts out? Are you aware of the National Fire Protection Association guidelines? Are you aware of the new potential OSHA mandate for fire brigade for enhancing health and wellness? Just really getting like in-depth detail. But then now looking at barriers. What does accessibility look like? Do you have gyms in your town? Some don't because of how rural they are.
Oh, right. Yeah.
What is your accessibility to a large chain grocery store? Over 50%. The closest accessibility is greater than 31 miles away to a large chain grocery store. So now think about the barriers within that for nutrition, right?
Right. Yeah.
So really looking at this of like, what are like department level barriers that would affect everyone?
Mm-hmm.
And that was,
I bet you when you inquired about health and wellness initiatives, so important to have, but I still think the leading cause of death is sudden cardiac events in firefighters. So we know how important it is. But to use my kids' term, I bet when you asked if there were initiatives, you got crickets.
Yep.
Yeah.
What more so interesting, Tom, is like not a lot of people were aware of even NVFC policies, for like heart healthy firefighter and things like that. Right?
And one of the reasons is, and we could get off topic here, but I think, in my humble opinion, one of the reasons is volunteers' most precious commodity is time.
Yes.
and they spend an enormous amount of time, whether it's responding to calls, training, or doing whatever else needs to be done at the firehouse to
Yep.
keep it running, paying
Yep.
bills, painting, whatever it is. There's
Yep.
no time to sit down and go, I got to think about eating healthier, or
Yes.
I got to work physical fitness into this. I don't have time for that.
Yes.
I got to get home, right? That type of stuff.
Yes.
So,
Yes. And honestly, that was what was echoed all the time. Like, did the results shock me based off of like the year and a half long like adventure I went on, if you will, with like really talking to firefighters in South Dakota? No. Does it shock me from a career level? No.
mm,
But what does shock me is the idea of almost some of the barriers are very similar to that of what we would call general population. So me, right? Or the rest of your family who's not a volunteer firefighter. You have the same exact barriers.
right.
Same. And then, like, the idea too for rural communities' health overall is lower because of accessibility to healthcare, accessibility to gyms, accessibility to qualified personnel for education or implementation. So was I shocked holistically? No. But I was excited then in a way because I know something could be done. So it gave me hope that we had that many people respond. But then it gave me hope because there was a question there, Tom, that actually goes through and says, part of the next phase of this grant in year 3 is to do a wellness initiative for departments, to actually give resources to do these things for departments. Would your department be interested? Yes or no? Less than 50%, probably about 40-ish, 35-40% said yes for physical activity and exercise, right? Because then they said, yes, I want injury prevention. I want ideas of education, programming, things like that holistically.
Mm-hmm.
Nutrition was less, but we also know just telling anyone to eat at any level in life is not, people aren't receptive to that. But we did have people interested. But, honestly, one of the most common reasons why people anecdotally, like what they typed in, they said, it's time. How can I get more people to volunteer on volunteering?
Mm-hmm.
So is it something, I've been thinking about this a lot lately, like after I was in Spearfish, like, is it flipping the narrative? Like, is it really volunteering or is it taking time to better yourself for longevity?
Right.
So is this something that's like just volunteering for this research, or is it now volunteering for behavior change that can help?
Behavior change that can lead to lifelong benefits.
Yes.
I mean, the cancer epidemic is real. The cardiac events are real. And I think sometimes we all bury our head in the sand. It's not going to happen to me. And,
Yeah.
sometimes you really need a wake up call. So,
Yes.
it's interesting that, that what your research is confirming. I hate to say what we really knew, but we're afraid to admit.
Yeah.
So,
Yeah.
What
Yeah.
else did your research show? Anything else that it was showing as you interviewed these people and talked to them? And
So then we move in year 2, starting year 2, we're doing focus groups now. So we are narrowing it down. We're at this department level, like broad picture, right? Now we're going to do focus groups, get some more in-depth questions. What are the true barriers? What are people seeing? But now splitting it up into fire chiefs and firefighters, 2 separate groups. So is it the idea top down, bottom up? Which way should it go? Right? Gosh, Tom, an hour for each session is never enough. So you have to kind of hurry it along to get some of the questions answered. The passion in the responses was great. Like, their whys are so impactful, right? Like, their whys are the reason why we need to do this. They don't want to go to any more funerals. And so that was very impactful for me. It was the first time my graduate student has been a part of this research working with firefighters. And he was like, man, Dr. Barry, that was so impactful.
Mm.
You know, like, because they don't see it. Like, young kids don't get it. And so now you're changing the narrative too for these young people to really appreciate what volunteer firefighters go through.
You know, I got to think too, if you made that part of the culture in the volunteer fire service,
Mm-hmm.
the focus on health and the focus on nutrition,
Yeah.
I dare say there's a recruitment tool right there.
Yeah.
You know,
Yep.
you know, look what we're going to provide for you.
Yes. Yeah. Especially in rural communities where their accessibility is low.
Yeah.
You know, so I think about it from that holistic approach. There were a lot of good insight, you know, like, should it be a third party coming in, like a group of me and my team come in and help? Should it be individualized, you know, that internal motivation? How many people are internally motivated, though? I think about this at like a general idea. Internal motivation for nutrition and physical activity is hard.
Yeah.
Like, think about why group exercise classes are so impactful now, because you have accountability, you have socialization, you have all of these wonderful things that also help improve your health.
You know, I like to say that we do so much together in the volunteer
Mm-hmm.
fire service. You need a new roof, you're going to have 20 brothers and sisters come over. You need help with
Yes.
any project, you're going to
Yes.
get advice, you're going to get help. Why
Yep.
don't we do more of that when it comes to physical activity?
Absolutely.
I like to talk about, why don't we see more groups from fire departments doing 5Ks together, or
Mm-hmm.
community walks if they have them. I understand not all rural areas, but you know,
Yep.
the idea of rural
Yep.
or community walks, community events. You don't all have to be a runner, but you know, do
Yep.
5Ks where you just things like that, and doing it together.
Yes.
There's
Yes.
merit in that, and
Yes.
people are motivated better when
Yep.
oh, Joe's going to be there or Jane's going to be there. Yeah, let's do that Saturday morning. You know?
Yes. Yes.
Mm-hmm.
And I think like those are some of the things that we think about as we move forward, and like, what are the most impactful things we can do? You know, like, how do we provide education? How do I, as a land grant institution, serve my community?
Right. So you get this information, you sit down with these people,
Yeah.
you have your focus groups, you've done some research.
Yep.
Now what do we do? What's your
Yeah.
goal? What do you want to do?
Yeah. So the next step is we'll do a fire chiefs focus group in the spring. In next year, so like, let's say N26, end of year 20, mid-year 26 through 27, is to then do a wellness initiative in some departments where they do get accessibility to resources, right? I have RDs who work with me on my team. I have strength and conditioning coaches. I have renowned tactical strength and conditioning professionals, you know, looking at CBPR methods. How can we really see this, but then also give them objectively measured differences? Like, what does body composition look like pre and post these interventions? What does physical activity look like? What does behavior change look like? So it's giving them all the resources, but then giving them maybe sustainable resources afterwards, like the testing, right? Body composition, stuff like that. You might not carry in your department, but what you do carry now is this resource for the longevity of the department.
Yeah.
So that is now where I think about it. And, you know, my students point out to me is like, well, Dr. Barry, that's not enough. That's not enough. We got to keep going. So now you have all these students so excited. The one cool thing is I actually have two students. One just graduated. The other one is a junior this year, and their dad is a volunteer firefighter for one of our rural departments. So what better way, Tom, than like showing them this, and their applied field of study can change the lives of their dad and their fellow members in their community? How cool. Like, how cool is this, that it's not just affecting the fire service itself, which is huge, very huge. But then at the same time, now we're bringing in people, fresh minds that are thinking of ways to get their communities active.
Yeah. Yeah. That's really cool. What are some of your ideas for rolling this out and getting people active and more focused on it. I know you have a team that can go to the
Yep.
firehouses.
Yep.
What are you finding that could be done if, maybe there's not teams out or all my listeners are and things like
Sure.
that, but what can we do?
Honestly, I think it is reach out to people. Reach out to right, you nodded when I said Sarah Jenke's name.
Oh yeah, everybody knows who she is.
Everyone knows Sarah. She's wonderful, right? They have connections to researchers in your area. I'm not saying everything needs to be done with research, but what I am saying is, like, most researchers then know the right people within your communities who are legitimately going to help you.
Yeah.
And have the backing for it. Because, like I said, each department's going to be different. Each need is going to be different. The age range of each department is different, so the needs vastly change. Same concepts, but how you execute it could be wildly different. But I think that's something, is like, reach out to people. I honestly think that is what's going to change the game for the fire service. But like we talked about at the beginning of this, is that I also want researchers out there to know, like, stay in it for the longevity of the people, not just for one study and leave. That doesn't do anyone any good.
Yeah, that's a good point.
And, so, like, if you do that, then it's burned bridges, and then researchers like me or Sarah or Judith, or list goes on, of the wonderful humans out there doing wonderful things for research and fire service. We have to reassemble the bridges. And the trust, and I get it. It's harder than to gain trust. Like, working in the fire service, once you're in, it's such a wonderful, like you said, brotherhood, sisterhood of, like, wonderful humans.
Mm-hmm.
But if you burn the bridge, it makes it so hard for someone else to enter who wants to care.
Yeah.
And wants to make this sustainable.
Yeah. I'm afraid to ask, what has your research found out? What are some of the statistics about health and wellness initiatives, or are there success stories out there, or is it?
Yes.
Okay.
Yes. So success stories, as far as I know, in career departments. Volunteers that I'm aware of, like longevity sustainable systems, I don't know off the top of my head. Have there been initiatives that work well and we see that the intervention actually made a difference for health and wellness? Yes, absolutely, in volunteer. But do we see that it's sustainable? I don't know.
Yeah.
I think about, like, Denver Metro and their wellness initiative, where they're so resource heavy. Their return on investment is quite high for this wellness initiative. So how do we start bringing some of that into the volunteer fire services? Like, that's the best part of my job to think about. It's like, how do we do this? How do we make it sustainable? How do we change the narrative that allows volunteers to do that? How do we create buy-in in the state level?
Right.
How does the state support?
Do you think you're going to need, like, would state support help? Do the volunteers, are they going to need some enticing, some sort of maybe stipend, or some sort of verbal encouragement is one thing.
Yes.
Is there other things that have to be considered there to get people off the couch and eating healthy?
Yeah. This is no different than anyone else, to be honest with you.
Yeah.
Everyone loves an incentive. Yeah. That was one thing that was brought up in some of the focus group, is how do you incentivize people to do it? I don't know yet.
Yeah,
to be honest with you.
It's interesting. My department, I'll use my department as an example of trying some new ideas. Pre-COVID, we had a local physical fitness trainer come to our firehouse twice a week and offer free training for an hour. We're fortunate we have a physical fitness room in our firehouse because we put one in, built it. And then COVID hit, and then we brought another one after COVID, and it didn't have the buy-in that it had before that. People weren't showing up for it. I don't know what the answer is there. And the other thing we did once or twice now is on our drill night, our training night during the winter season when we do more sit down drills. We did bring in a nutritionalist once to speak
Mm-hmm.
about cooking healthy.
Mm-hmm.
In my area too, I'm Buffalo, New York. We're the land of pizza and wings. That we in our fire area, and the same is true for a lot of firehouses. We don't do much without a meal, and,
Yep.
and
Yep.
those meals are not always healthy.
Oh
So
gosh, yeah.
our intent was good. We brought in a nutritionalist to talk about eating healthier, things you can do at home to meal prep, and just and everyone's rah rah, but then it just fades away. So
Mm-hmm.
I think you can come with the statistics to the fire departments based on
Yep.
your research,
Yep.
offer ideas, but getting to that next level and sustaining it, like you said,
Yes.
that's a challenge.
Yes. And that's, I think, that's the biggest idea of how do we make this sustainable. I don't know yet.
Yeah.
I don't know that answer.
That's why you're the doctor.
I mean, it also gives me hope that my career will be long.
Right. Right.
But my idea is that I also, gosh, what's the best way to do it? And
Yeah.
what's the most impactful way to do it? And maybe it's not going to be life changing overnight, but we are making small strides to it. We're, South Dakota at least knows they have someone in their backyard who's here to help.
Yeah.
And if anything, maybe that's what we learn from it, is that there are resources available when you know who the right person is to ask.
Right.
So I think that there's a lot of great things we can actually learn from it, and a lot of great takeaways we can get from it.
And what I like to say too is sometimes we got to look in the mirror and we got to be honest. I think I said earlier,
Yes.
we have our head in the sand. This, the cancer epidemic is very real.
Yep.
We all talk about things we can do to mitigate the cancer risk when it comes to washing our gear, staying out of the smoke, staying on air at fires. But eating healthier plays into that. Exercise plays into that as well.
Mm-hmm.
It's like you said, it's not the sexy topic. It's not
Yep.
the cool topic. And
Yep.
I really think sometimes we need to look in the mirror and be honest. And we need that kick in the butt. We really do. So I commend you for what you're doing. And I want to circle back to you. That I just want to. You said that I believe you said the physical activity and nutrition accessibility varies greatly between career departments and volunteer departments. Are you saying there's some career departments then that incentivize that? They
Yes.
like Denver, you said.
Yeah. So I would like resource heavy in
Mm-hmm.
a sense, is that like you think about Denver Metro, they have like a strength and conditioning person on staff.
Mm-hmm.
They have all these people built in that is almost like their own like health and wellness body of people. Like well, I was at Science the Station last year, and some of the research that they were showing, you're like, they figured it out. And the accessibility for it, that they know that the return on investment, if we provide all these things, actually helps us tenfold. We're not having to take people off the truck with less injuries, less people off the truck, less overtime, time and a half, right? You're not paying for the injury care because less injuries overall. So you see this and you're like, okay, well, it works somewhere.
Yeah.
But you have to start small. And so I think it's like doing small things to then everything's about the dollar, right? Whether we like that or not, it's a fact. So how can we save money by doing some of these initiatives? You might have to spend money to save the money.
Right. No,
And I think that's the bigger concept, like I have to spend this money to then, for every dollar I spend, maybe my return on investment is $5 back in my pocket.
and I would think on the volunteer side, like as opposed to the career side who maybe has someone on staff,
Yes.
the challenge is going to be having a representatives, maybe whether it's county funded,
Yep.
state funded, however
Yep.
it's done, that maybe they would, instead of being on staff of a volunteer department, they would be available for a county or counties or
Yes.
something like that.
Yes, absolutely. Actually, this is what I was just talking about the other day. It was the exact same thing. Is like, how do you still provide resources, but it's not, you think of like, instead it would be almost like resource scarce, like it is there, but not as prevalent for each department, versus you have like resource abundance for some career departments. Because not every career department has that high resource either.
Right.
So it's really creating the buy-in. But then for a career, it's like creating the buy-in from HR, from the city, from the chiefs, right, also have to buy into it, and then having people actually engage in it.
Right.
So like, does that happen because you get incentives that you meet such threshold on your annual wellness exams, like your annual fitness assessments? Is it when you're doing your fireground fitness assessment, or if you're doing metabolic testing, if you're doing things like that, how does that work? And that's how you're incentivized, by days off or something like that. I don't know. Like every department does it different.
And the thinking,
So
a lot of people think that, firefighting by its very nature is high intensity job,
yes,
but
yes,
that's a very small percentage of the time. I think your research bore that out, right?
yes,
So they're finding firefighters are, the obesity level is higher than the general public.
yep,
The incidence of diabetes and cardiovascular disease is higher than
mm-hmm,
the general public, if I
mm-hmm,
remember your research correctly.
mm-hmm,
So that should be reason enough to get us all off the couch. But
yes, yes,
and on my take as a professional volunteer firefighter, being fit for duty, it's not a paid or career thing or a volunteer thing. That should be what we all should ensure we're fit for duty.
yes,
So that should be the incentive enough right
mm-hmm,
there. You're
mm-hmm,
fooling Mr. and Mrs. Public if you can't
mm-hmm,
do the job.
mm-hmm.
You're just fooling them. They think you're capable of doing the job, but the statistics show that, what is it, 70 something percent are fall into the overweight or obese level. I don't have the numbers right in front of me, but
Roughly,
yeah.
yeah. Mm-hmm, mm-hmm.
So
And so I think, like, honestly, Tom, from my take on it now, is what I look at is one step at a time, one step at a time, one day at a time, one department at a time, or maybe just one firefighter at a time.
right,
Like it's almost like when I think about it, it's like teaching in some respect, right? Like you give students the resources and the tools to be successful. Do all students utilize it? No. A good portion do. But I can't force people to be successful. I can't force people to make a change. But I do want someone to give them the opportunity to allow them to make the change.
and have resources for them if they're
Mm-hmm.
desiring to change.
Yes.
Give me the
Yes.
help. I
Mm-hmm.
want help. I want to change.
Yep.
And department wide, I'm thinking again, little things lead to big things,
Yes.
and if little changes are made, if and a lot of things starts with leadership. If department leadership embraces this idea, let's say you bring the statistics, you offer some resources how they can help themselves to
Mm-hmm.
better, to get more exercise. If department leadership embraces that, and even if it's just a few people that start, whatever they do, whether they meet once or twice a week, whether at the end of drill for 15 minutes they do something healthy, however they do it.
Yeah.
About this, as new people come into the ranks, this is normal.
Yes.
They don't know how it used to be.
Yep.
This is just how it is. So start small.
Yes.
But keep
Yes.
going, and you circle back to what you said. It's sustaining it too.
Yes.
You can't have one champion.
Yes.
One champion can start it, but then you need other champions to latch on.
Yes. And that's the goal for anything, right?
Right.
Is it we just need one ripple.
Right.
Really.
Right.
And like if we can do that, those small changes do affect greater change. And I think that's where we can go with this specific project.
Yeah.
Which is wonderful, right? It's the idea that there's projects out there that are trying to do something different. and that there are wonderful researchers out there who are trying to help and trying to do these great things because you allow us in.
Yeah.
Right? Our job wouldn't be possible if we didn't have wonderful people that will let us help.
Yeah.
That's how I view it too.
What's next?
So next we
you have aim 1, 2, and 3, wasn't that it?
Yep.
Yeah.
Yep.
Aim 1
Was the needs assessment.
needs assessment. Aim 2 was the focus groups.
Yep. And aim 3 is going to be actually delivering a wellness initiative. So aim 3 will start, like I said, somewhere around early spring, late spring, early summer. Figuring out how we figure out what departments do it for inclusion and exclusion criteria for it. Helpful from the needs assessment for the ones who did say they wanted to participate in it. Then really deciding like what are the real inclusion exclusion, how many people are on the department, right? It's gonna be hard if it's only 5 people on the department. Majority of our department sizes on average in South Dakota seem to be around like 32 members ish. There are some obviously way less, but then there are some that are more. So I do think that there are a good number of departments who did participate that would be great for it. It's just figuring out how to select them. So that'll be something. But then also in the meantime, working on more grants to then build out more implementation of this, but maybe in a broader scope, maybe including, tobacco cessation, alcohol consumption, education, chronic stress. What does chronic stress look like in the volunteer fire service, right?
How about
sleep? Yep. So like all of these things that you're now doing a more holistic approach. Those are the next steps. I don't know in what order, honestly, Tom. I don't know the order, but I do know that more grants will be applied to keep moving this research forward.
So you're going to come up with these programs and these ideas, and then if this keeps going, your hope is to roll it out statewide.
Yep.
And probably have, for lack of a better term, ambassadors of the program.
Yes.
In the different areas of your state.
Mm-hmm.
And like I said at the beginning, Dr. Barry, is so much of the findings, even though it mirrors South Dakota, applies equally across the board. It's like we found out that very few departments have health and wellness initiatives, especially in the volunteer ranks. Very few departments have even comply with the physical examination mandate with 1582, which is hard, costly. I'd like to see everybody do the cancer screening. I think you're seeing a little bit more and more of that. So there's so much to champion with what you're doing. And it can keep growing. And awareness is number one. And I think we're aware. I do think that there's publicity about it.
Yep.
And now it's, I got to do something about it. I can't sit here and get better. And I'm guilty of it like anybody else. I am. You need the kick in the butt to do it. And, that's why I love the idea of you got this grant. I love what you're working on. And I want to help get the word out that it's important work and there's more coming. And it's all designed to make us healthier and be better at our job. And again, it doesn't matter if you're volunteer or career. Being fit for duty, it's one of the most basic requirements of the job.
Yes.
And sudden cardiac events are still the number one killer of firefighters while on duty. Cancer gets you over time, but sudden cardiac events, number one death. And it's been for a long time. Think you're going from 0 to 100 miles an hour in an instant, sometimes from a sound sleep. And it doesn't happen all that often. So it's even if you're not exercising that heart and those muscles, when you do, they could fail you. So
yes. Yeah. No, I'm excited, Tom. A lot of good things ahead.
Would you keep us informed as to your progress? And I'll get the word out to my volunteer followers out there because this is important work.
Yes, no, absolutely. And thank you so much, Tom. Thank you for taking the time. Thank you for allowing me to talk. Whatever we can do to help, that's what our job is.
Yeah.
But also to help build awareness, build out the initiatives, build these programs, but also allow them to change over time. Because what works now might not work 10 years from now,
Right.
but at least we have some resources built that we can modify along the way.
Right. Right. If anyone had any questions or wanted to reach out to you, could you share your contact information for the listeners?
Yeah, so if you have any questions or anything, it's probably easiest to reach out to me at my email address, Allison, Allison .Barry, Barry, at sdstate.edu.
Awesome. Is there anything else you'd like the listeners to know about your research and what your ultimate goals are? Longevity, right? We want
Yes,
to, yeah, and healthy retirements, whether it's
yes,
the career side or the volunteer side.
absolutely,
And little steps
absolutely.
now can pay big dividends down the road, right?
Exactly. You worded it perfectly.
Well, thank you so much for joining us here on the Professional Volunteer Fire Department. One of the traits of a true professional is being fit for duty, people, and I think we could all do a little better. And Dr. Barry's working on some great things to help us in that regard. Yes, she's in the state of South Dakota, but I think the message is important for all of us in all 50 states worldwide. We got to take care of ourselves. And sometimes it just takes a little talk like this to wake people up and maybe get them to focus on themselves. As volunteer firefighters, we focus so much on our communities and the people in them, which is great. Sometimes we got to focus on ourselves too. And like I said, peer pressure is a great thing. Focus on the brothers and sisters. Put a little peer pressure on them. So thank you so much, Dr. Barry, for joining us. I appreciate it.
Thank you.
Folks, again, thank you so much for listening into the Professional Volunteer Fire Department. As always, if you have anything that you want to talk to me about, if you have questions or guests that you recommend for getting on the show or any topics to talk about, feel free to reach out to me. My social media platforms, the Professional Volunteer Fire Department, Facebook page, Instagram, my website, or email me, tamerrill63 at AOL.com. Again, tamerrill63 at AOL.com. Give me a shout. Love to hear from you. Love to see you when I'm out at any of the conferences, traveling around. And if you have any things at all you want to talk to me about, don't hesitate. So thanks again for listening in. My next show will be December 16th, I believe, just before Christmas. And we'll keep the conversation going about this great volunteer fire service of ours and all the things that we can do together to earn and keep that professional brand, both personally and also organizationally. So remember at all times, folks, your residents are owed professional service being delivered by professional firefighters who represent a professional organization. Stay safe.